At the back, as we'll see if we remove the capsule, the thin synovial membrane, here it is, passes forward around the cruciate ligaments, covering them on the front. Besides being the largest joint in the body, the knee joint is also much the most complicated. Before we move on to look at the muscles which produce knee movement, let's review what we've seen of the bones and of the knee joint. On the femur, here's the lateral condyle and epicondyle, the medial condyle and epicondyle, the adductor tubercle, and the intercondylar notch. On the tibia, here's the lateral condyle, the medial condyle, the tibial tubercle, and the facet for the fibula. Here's the head of the fibula, the neck of the fibula, the proximal tibiofibular joint, and the patella. Here's the medial meniscus, the lateral meniscus, the anterior cruciate, and posterior cruciate ligaments, the fibular collateral ligament, the tibial collateral ligament, the quadriceps tendon, the patellar ligament, and the joint capsule. Now we'll move on to look at the muscles which produce movement at the knee joint. We've met most of them already. The one muscle that extends the knee is the massive quadriceps. We saw it briefly in the last section. We'll take a better look at it now. The main flexors of the knee are the so-called hamstring muscles, semimembranosus, semitendinosus, and biceps femoris. Besides flexing the knee, the hamstring muscles also extend the hip. We took a good look at them in the last section. Here, we'll just revisit their insertions. In addition, we'll look at three muscles at the back of the knee that we haven't yet seen: popliteus, gastrocnemius, and plantaris. We'll start with quadriceps. Its name comes from the fact that it has 4 heads. Oddly, these are named as though they were separate muscles. 3 of the heads arise from the femur. They're called vastus intermedius, vastus medialis, and vastus lateralis. The 4th head, rectus femoris, arises from the hip bone. All 4 heads converge on the quadriceps tendon, which we've seen. We'll start with the deepest of the heads, vastus intermedius. Here it is. It forms a bulge on the front of the femur. Vastus intermedius arises from this broad area around the lateral aspect and front of the femur. Wrapped around the outside of vastus intermedius are vastus medialis and vastus lateralis. These two cover vastus intermedius almost completely. Their fibers run obliquely all the way round to the back. Here's lateralis, here's medialis, almost meeting it. Vastus lateralis arises from the lateral edge of the linea aspera and from the side and front of the greater trochanter. Vastus medialis arises from the medial edge of the linea aspera and from just below the lesser trochanter. The thin strip of bone between these two lines of origin provides the insertion of all the adductor muscles and also the origin of the short head of biceps. Now let's add rectus femoris to the picture. Here it is. Rectus femoris arises from the ilium just above the hip joint. Its tendon of origin has 2 parts, a posterior or reflected part and an anterior or straight part. The anterior part arises from this prominence, the anterior inferior iliac spine. The posterior part arises from just above the acetabulum. All 4 heads of quadriceps converge on the quadriceps tendon. The lowest fibers of vastus lateralis and medialis insert onto the sides of the patella. The principal action of the quadriceps muscle is to extend the knee.